say one thing, they do another. Even at Eagle Square yesterday, there was no social distancing when the president was doing, so it makes you really wonder if we really have that second wave here. But for me, I think it's here, and we are living in that reality. But again, maybe we just beg the government to see how they can try to marry the reality of COVID with what we have on ground. The reality is there, but the things that the government do are directly opposite to what they tell you. Don't go out. Policemen go out to arrest people who don't wear masks, even in clubs. But they allow people to gather in the daytime to register for NIN. They allow people to walk the street. They themselves don't even wear the mask. So it makes you want to doubt if there is actually a second wave.
I think the fact that a lot of people don't believe that COVID is actually the problem in itself. Like a lot of us are exposed to. Look at everywhere now. Few are on nose masks. There are queues everywhere. Body collision everywhere. And I think with the way the present situation is going, right, the government should consider another lockdown, because that's the only way we Nigerians can listen.
The government is doing well, but doing well, it's on a very low level. Because if you look at the reality of it in other countries, government are trying to do everything they can, but the Nigeria situation is really different now. For instance, you see that even now, government is still much bothered about going to register for NIN instead of letting people in, or even thinking of having a lockdown for a second time. So the government is doing well. I don't want to say they are not doing well, but they're doing well. I'll just say maybe 20 or 100.
I think it's better to restrict us and to go into another crisis.
They keep saying it on news, try to manage the spread. But what exactly are they really doing to manage the spread? You can see everyone here is out, and if you check, like 90% of people out here are not using nose
98,
masks.
you may say.
You don't have like coming out where you can easily wash your hands, sanitize, and all of that. I mean, these are things I feel the government should have even looked into to see how the general public is safe from all of that, how we can try to manage the spread of it. But all of that is really not being looked
in the
into.
papers, like
And bringing it back to the lockdown period, people were just indoors. I mean, the government didn't do a whole lot to see how they can help people. And the reason why people at that point could not even stay indoors again was the fact that, we are indoors, we're not provided with finance, we're not provided with food, our family need to eat, and so people just, started going out eating. So I feel there's a whole lot they have to do just to see how they can manage this spread.
The fact that the fact that a lot of people don't believe it is real is my real problem. Like, you tell them, even if the boss when I was coming now, people are still arguing. This stuff is just, the government is trying to exploit us, the government is just trying to blah 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 blah. That's the main problem. That's the main problem of Nigeria. And they think, some people have this notion that it's a big man disease.
Ọmọ kí ló ṣẹlẹ̀? Some people can be like ants, corona. Wetin dey sup? Máwèèyàn. Bọ́ ìdàbí ṣíṣí.
Well, hello everybody. My name is Fumi Inyonda, and this is Public Eye. Today's show is about COVID-19. Last year, the pandemic caused by this virus devastated the world. It's been a year, and yet we are rolling into what has been called the second phase of the disease and the ensuing pandemic. In the time, many countries have suffered. Economies have almost collapsed. Some have collapsed completely. In the wake of that, millions of people have died. It's taken devastating effects on families, countries, and societies. Some have also argued that this pandemic provides opportunity to reshape the future. This conversation will be about Nigeria's place in this thing that has happened to the world. Where exactly is Nigeria? It would appear that we have gotten away lighter than was anticipated. But really, have we? And what sort of future is Nigeria willing and able to shape in the wake of something that has transformed the ways in which we are going to live from tomorrow? My conversation will be with an array of minds, and I would expect and hope that you will be one of those minds as you join us in this conversation right after the break. Right, welcome back. And it's Public Eye. The conversation today is on COVID. Actually, all the conversations for now is off and around and about COVID because it's the most important thing in our present reality across the world. And to join me in starting the conversation today, I have on my left-hand side, Dr. Adetunji Adenekon. Dr. Adenekon is a consultant ophthalmologist. He also is the chairman of the Lagos State branch of the Nigerian Medical Association. Of course, the doctors and all the other healthcare workers are on the front line of the pandemic. Good day, Dr. Adenekon.
Yeah, good afternoon. Thank you for having me.
Good to have you. It's good to see you. Right. Also with him this morning or afternoon. We're afternoon, yes, we're in the afternoon now. Also with him this afternoon is Mr. Joy Akon. So Joy is well known on social media. He's a journalist and a writer and the brain behind Afrobeat Intelligence, which is a niche publication on social media and off it of, the heart of the arts and the creativity in Nigeria's Afrobeat industry. Good afternoon, Joey.
Yeah, good afternoon. It's good to be here.
Good to be here. So you're a bit of a troublemaker, and the trouble gets into her.
No, but that's what they say.
That's what happens.
Yeah.
We'll talk about that. But we are in trouble, so this is one of the reasons you are here.
Yeah, definitely.
The world has been in trouble for a year. It's, I don't know where to start, but I'll start with what exactly is going on. Globally, the world is entering a second wave. It's also said that Nigeria is going into a second wave, although people argue that, but what was our first wave like itself? You tell us what the real situation is out there in the hospital. The reports we hear is that the isolation centers are full, doctors are dying, healthcare workers are dying, and there are more people dying that is being reported. What is the state of affairs, Dr. Adenekon, really?
All right, thank you very much for that question. It's just good to say again that we need to do the best to keep the health of the nation. I must say that people are still wondering whether we have a second wave. We do have a second wave right now. Because at the first time, that was the first wave, we got to a peak and the numbers started going down. And we were able to maintain and around the flat curve at a particular period. Even within the isolation centers, we have about 2 to 3 cases per week to tell us that we are getting better. Then a surge came again towards around December, early December, and all that. And the numbers started going up, and it's still going up right now. So that is what we mean by the second wave, which is here, because people have increased the numbers who are in the isolation centers. All of the hitherto closed down isolation centers are now beginning to open up again. The known ones, which is 2 in Lagos State, the Infectious Disease Hospital and Lasut, the one in Lasut. Then we have 2 federal in Lut and FMC Butimeta. They are completely filled, and now we are having spillover to other centers who are beginning to open up now. Be that as it may, we as health workers, we are the frontliners, and we are also the person who sees the asymptomatic cases as well. We are 3 times more fold to get this disease, and as is obvious, as our yesterday's count, we have 1,049 cases of doctors only that have been affected by COVID, and in Lagos alone, we have 100 as I speak with you, and 25 have died, as the case is. So the number keeps increasing.
It seems like more people are dying this second wave than did in terms of the number of people infected and the number of fatalities that are occurring.
Yes, just like we're being told that this second one is more fatal,
You're excluding the second
You said
strain.
we are being told. Is it not true?
Yeah, what I'm saying that is that by evidence, well, what we see is what is happening. That whether you died of first strain or second strain, we don't know because of this strain, because we didn't do the test to know which strain the person is exposed to. But what we know is that this second wave is actually more deadly than the first one, as the case is. It may be either by people not doing the things they were doing the first time, like all this issue of non-pharmaceutical like guidelines prevention. People have thrown that the dustbin, they are not following it. Or it may be the fact that this one is even affecting younger ones with medical illnesses compared to the first one, which is taking more of a elderly. So all these are still things to wonder about and look at the data and compare to what the whole world is looking at.
So Joey, you were accused of being a skeptic at the beginning of the pandemic, and some said that it was the act of God that you then got COVID.
No, I've never been a skeptic, and it's weird how people equate critical thinking with skepticism. It's extremely weird. I've never been a skeptic. I have a medical background, a basic medical background. That's my first degree.
So you studied to be a doctor?
No, a biochemistry. So I did a lot of clinical biochemistry.
Yes, and you now started.
And I worked in a
Afrobeat.
hospital. Well,
Your poor dad.
No, I went after my heart.
Right.
You know, I followed
That's
my
a different
joy.
conversation.
So yeah, for me, it's about critical thinking, and much of it is directed at the government. While we might look at this situation now because it involves life and death, and the PR around it has been massive because, you know, there's no cure for it of sorts, and the vaccines just came out. So we've found a way to trust this government with a lot of things. And the way I see it, I've been in Nigeria, I've lived long enough in Nigeria to know that the government has never at any point in time.
You use the word PR rather than information. So you didn't say the information around COVID, you said the PR around COVID.
Yeah, it's still PR. It's still PR. It is. Like, of course, COVID is deadly. Of course, there's no doubt about that. But like,
you caught COVID.
Yeah.
You were very sick.
I wasn't very sick.
You were a little sick.
Yes, I had mild symptoms.
Okay.
And you know, the PR around it was, people are dying and all of that. But because it's new, because it's novel, because it's the new, in a manner of speaking, new shiny disease, everyone's all about it. But when you really think of it, we've had malaria here for so long, and no matter how much we fought malaria, it still kills us. It still kills us beyond measure. We've had other illnesses or other pathologies that have carried us, that had more fatal cases. But COVID is new. COVID is shiny. COVID, and so everyone's all about COVID. But where the skepticism comes from is every time I question the government that these people have never proven to have had our backs at all. When you check the history of Nigeria, this government operates for itself. This government operates for its pockets. Mm-hmm. We've seen it happen across board always. So why do we wholly and totally trust this government to do right by us because it's COVID?
It's important to have these conversations because there's a lot of distrust of government. There's also a lot of skepticism around COVID because people don't trust the government. And that's why it's good to have a conversation with Dr. Adenekon, who is here. Why are we having this conversation? Is it because we haven't had as many fatalities? Are we therefore risking the possibility of going into a full-blown situation where people are dying in hundreds if we go down this line? Why COVID? Why should COVID be something that we shut the economies for example?
Okay, let me start by saying that an average Nigerian itself does not believe that there's COVID, either because of what government is doing or what they are not doing. It is an informative world. You don't need to have your own government before you believe that there's COVID-19. So whether your government responds to it appropriately or not is another thing entirely. But even what the government has asked you to do, what is your own, what have you done about it? Are you taking charge of your own health? Because you can say government did not pull this, they did not pull that, but the part you are supposed to take, have you taken it first in the first instance? Now, I would say that COVID is something we're talking about because of the mode of transmission, not generally because of the fact that it keeps people alone. Yes, if someone dies in one family, it's 100% for that family. So whether we quote percentage or not, the fact is that people die from this ailment. Now, when you compare it to malaria, the mode of transmission is totally different. When you compare it to Ebola, Ebola's mode of transmission is different. You get infected with Ebola if you move near somebody who has it. If you come to in contact with the secretion, sweat, whatever it is, saliva, and all of that person. But with COVID, you can be on your own lane and somebody is passing by, just sneezes, and you catch it. So it's to reduce transmission and make sure that we take the number to a lowering, almost to a flat level. That's why the noise about this is much. And a responsible government will do what we are doing concerning this. It's just that how effective are the things that we are doing. There's a government part, there's a part for the citizen to take. And in that video that we watched, you can see that people are not even doing all their own part.
Yeah.
How much more to talk about what the government is doing, things that we want to
So Joy, I mean, Dr. Adeneko has laid the foundation to where I'm going to go, that the thing that's novel-ish about this is that more than a lot of pandemics has happened before, this is the one thing that shows how interconnected everybody is. So what is your grouse, for example, concerning the government? What did you expect, or what do you expect the government to do that will be different, that will affect the outcome for what might happen or what could have happened with COVID?
With COVID first, I don't think we've tested enough. I don't think we have enough testing in this country. We're a country where we brag about our numbers, 200 million people, which I still think is not accurate. But out of 200 million people, how many testing centers do we have? Even in Lagos, the population of Lagos is, I think, 20 million or so. That's what they're saying. But how many testing centers do we have? We've had issues, we've had cases of people reporting, calling the official numbers and saying, hey, I've got this. And they'll say, okay, stay at home. We've had people who have tried for so long to get tested and they can't. And then all of a sudden, after the first wave disappeared, guess what happened? Free testing disappeared. Free testing disappeared completely. Has the COVID gone? No. We've seen the same government or different arms of it hold political campaigns. We've seen politicians in power hold campaigns within the pandemic. We've seen people, even during this period, we've seen an arm of government tell people to go crowd out the NIMEC centers for the NIN, National Identification Number. Isn't that double speak? Would you trust the government that tells you enforce social distancing, but at the same time tells you, hey, all of you, go crowd out, go stay in spaces where there's a huge possibility of you getting this? We know it's airborne. Even the information regarding COVID, it's not even complete. It's something we keep discovering as we go. There was a time the World Health Organization told us that it wasn't airborne. It was.
Yes, there's a strain that's airborne.
Yeah, they said it wasn't airborne then.
So, Joey, my question is this, because this is a very crucial point we've come to.
Okay.
I don't think generally, when you speak about lack of trust of government, that lack of trust of government is new.
Yeah, it's not.
However, COVID is new from the people. The NIN registration, for example, I would have refused to go.
Yeah.
I would have refused to go. For example, if I had a young child, I would refuse to send them back to school.
Yeah.
You cannot make me send my child to school under those kind of circumstances, for whatever reason. And those are not the things peculiar to Nigeria alone. These fights and these conversations are happening in several countries. So what do you expect to be different? And how do we get that expectation?
What I expect to be different is a certain level of honesty about how this government is handling things. A certain level of honesty. And if we're very big on sensitization and creating awareness, then the message and our actions should tally. Like, I don't see any reason why you tell me enforce social distancing, and then the next minute you're telling me to go back to school. Telling my kids to go back to school. I don't have kids yet, by the way, but just telling my kids to go back to school. I don't see any reason why you tell me there's a second wave and we don't see you roll out massive free testing drive. There's no reason why you tell me there are vaccines available, and instead what's on the news is the government releasing someone in power coming up and screaming, we need to start having conversations about locally made vaccines. And then the next week, what happens? The government releases 10 billion naira for locally made vaccines. How? Like, all of these actions, they don't instill a lot of confidence in terms of the people. What the people should focus on, like I said, should be personal responsibility, of course. Personal responsibility. You protect yourself, you protect a lot more people. Also, you need to acquire more information regarding how to up your immune system, because we already know what this thing attacks. It's the immune system, and you have a greater chance of surviving this if you've got a stronger immune system. So personal responsibility. Take the things you have to take, live a healthier lifestyle, do not smoke, and incorporate exercise. These are the things that we should do as people. But in terms of relying on the government, nah, not at all.
Okay, I hear you, Dr. Adeneko. I see you moving.
Yeah. There's a lot to talk about concerning where the numbers now going not as high as the European world. There has been a lot of postulations. People are talking about BCG immunization, which almost all of us had when we were younger and all. And the latest on that is that they're postulating that we Africans and Nigerians have been exposed to a lot of emetic, that's worm infestation, while we were younger. And the kind of response that we have to COVID-19 for anybody who develops it is similar to that we are developed with the worm infestation. So that way, the body has some semblance of reaction rather than not at all. That's what has been postulated. And what I also saying concerning that is that for most people, it's an hyper response that kills them. Because they are responding too actively and the body fights itself. And that's what. But on the aspect of talking about immunization and vaccinations, I would say that we cannot say we don't need vaccines. We need help. And if you look at the total population of Nigeria, there's no way we can get all the help from outside. We need to look inside. We have our own research institutes. Just like we're talking about, okay, why are we having this strain? What strain do we even have? Are we having something different from what they are having to add to the knowledge of why it's not killing us like that? And this needs to be to be supported with funds. So in talking about the vaccine, we can't get 200 million vaccine from outside the country. So we need to look inward and see how we can begin to do some manufacturing of some of these vaccines. There are different kinds of vaccines. There's what we call mRNA vaccine. There's non-mRNA vaccine. The Pfizer and the Moderna, they are mRNA, very expensive to maintain. The AstraZeneca and all those ones, they are also see there, the COVAX vaccine. So my final shot to say is that we will hope that the second wave will not take more of Nigerian lives. We hope that people will begin to understand that there's indeed COVID-19 and it's still very much around, and all hands are continue to be on deck with everybody being involved, and that the enemy who has sworn an oath to protect lives, we keep doing that despite the fact that we are losing.
Thank you very much. So I'm going to stop this conversation here. There's going to be other parts of the conversations because, Dr. Adeneko, you mentioned the long end, the long tail of this, because everybody talks about, so many people have not died in Nigeria. We haven't talked about the economy, the impacts of the economy, the impacts on families, the impact on mental health, the impact on education, the impact on so many other parts of our life. Also, the impact on our relationship with other parts of the world where they have had a bigger toll in terms of number of people dying and the devastating effects on their own economy. We are going to look at all of those one after the other right after the break. Well, welcome back. It's Public Eye, and our conversation today is about COVID, or rather, how we are going to negotiate the next few months and ongoing with the realities of the pandemic. We are going to be joined now. We're joined now by Ms. Chioma Ogwegu, who is a researcher and a survivor of COVID-19. And she has also participated in drug trials. She takes this seriously. Dr. Adeneko is still with us. Joey's gone on so that we can continue the conversation. Chioma, good morning.
Good morning.
Is it morning or afternoon? I've lost track of time. Good afternoon, Chioma. Good to see you.
Same here.
I'm so glad to see you.
Yes, me too.
Because, yes.
Anyway, let's continue. Yeah, it was an ordeal, but at least I'm happy to be here. I'm happy to be alive. Yes.
Yeah. A lot of people continue to be skeptical about COVID. They think it's like malaria, you just get it and, that's it, it's gone. It's not that, is it?
No, it's not. Well, I think because lots of people also have mild symptoms, and there's also this idea that, oh, it's only people who have underlying symptoms or people who are old. So the messaging has been around that a lot. So most people think, okay, since I'm not old or I don't have underlying symptoms, I'm going to be fine, even if I catch it. So people are just, they're willing to risk it.
Yeah.
So because they think they will not die. But the truth of the matter is, from what I've seen, is that you don't know. It's like a Russian roulette. You don't know who will have it bad. You don't know whether you're the one whose case would be horrible.
Yeah.
And for me, the thing that I've seen is that, aside from actually getting the COVID, is the long-term effect that you don't know how it will affect you long-term, or even short-term, mid to short-term. So for me, things like, I think I was just saying it before I got on air, is things like, fatigue, random fatigue, like debilitating fatigue where you can't do anything else, where you're just, or sometimes just pain. Sometimes I have a group of women, not just women, like a group of people who are COVID survivors, and we basically just check in every day. So what do we have today? And then people are like, oh, I have chest pain. Oh, my I have arthritis that has now been worsened because of COVID. So for me, when I see people who just take it lightly, I'm just like, you don't know how this thing can affect you. So it's best for you to just, don't risk it.
Right.
Yeah. So,
Doctor, I mean, that's another bit that people don't talk about a lot. What is called long COVID, people who've survived COVID, and then ongoing health issues that, can ensue from that. There isn't enough talk about it. There isn't enough understanding of it in the first. In fact, how can there be when there isn't even enough belief about COVID itself in the first instance? How much do we know now about what happens and what the prognosis is for people who have survived COVID but still have symptoms ongoing in terms of future?
I would say, just like we know that it's still novel, so we can't say much of what people will see experience. I'll give a typical example, not to scare anyone. You can have hepatitis, which is caused by a virus, and you go through a phase, but that same hepatitis virus has been known over time to cause some other damages to the liver. So because of that exposure. So we don't know what people may have later. We just keep counting as the day goes by. Now we are talking almost 1 year plus of COVID. So when anybody has developed they develop any extra symptoms, there should be a way to report it so that we can start collecting those data so that we can analyze later. But there's one entity that I want people to look at, and it's on their mental health. Just like she mentioned now, they have a group, which is like a support group to each other, to one another. By the time you report a symptom, somebody can begin to allay your fear, or somebody can ask you to say, no, that is a serious one you need to go to. But the post-traumatic stress disorder, that's what it's called. It's not only the traumatic experience we are talking includes getting infirmities like diseases. So that aspect needs to also be looked at. There needs to be a form of support, psychological support, mental support for those who have been exposed to COVID-19 that are survivors. And really those that are even having active infections right now. And that's a part that should not be neglected.
Yeah, because people can get reinfected, after a while, even with the COVID. What you mentioned there is very important to note, that if you don't have a health situation that drags on for a long time, it affects a lot of things. It affects ability to earn, to work, and that can affect quality of life and affect so many things going on.
What is
you participated in the drug. Tell me about the drug trials.
Okay, so when I tested positive, I got initially, during the first wave, I would say there was so much care given to people who had tested positive to coronavirus. So I got a call from someone from the Lagos State government who said that they were doing drug trials for people who were positive of coronavirus, and it was something they called a double-blind trial, where I don't know the drug that I'm being given. The direct researchers that I was working with, they didn't know what drug I was being given. But so I was supposed to be put on the drug for 2 weeks to kind of know whether it was just basically a drug trial to find out which of the drugs that they have is most effective in combating coronavirus. So they put me on the trial. And I started, but I think by day 3, it was a lot. Like aside from the fact that I was sick already from coronavirus, but then I would just stay and then I'll just be having my ears ringing, constant ringing in my ears, constant nausea, constant headache, like blinding kind of headache. So I after about a week, I just said, I'm sorry, because I'm a researcher as well, because of my research background, I know the importance of research, but at this point, I just cannot continue with this trial. And that's how I work.
Right. I mean, you work in advocacy, across board in Nigeria. And I'm thinking this is clearly an area where, also an area maybe we can get consensus, because usually there's so many divergent, well, even for this, there's been so many divergent voices. But isn't this an opportunity to scale up capacity in Nigeria for healthcare, for research, medical research and all of that?
For
and
research in general.
Yeah, for research in general. And how much response in that direction have you seen?
Well, since I'm not in medical research, I wouldn't say much about medical research. But I know that even that, in terms of response, I know we did this genome sequencing. I know that we've been doing some bit of work, a lot of work around coronavirus. But in terms of even how corona has affected people socially, economically, there's still, that data there's really limited data on that. And I agree with you, or to support what you've said. Yes, we need to scale up, but currently, there's not a lot of it that I'm seeing. I know small organizations are doing so. If they're, for instance, some people who work with women, they just do a small survey in their city to say, okay, how does this impact women? Or people who work with queer people, for instance, are doing some other survey in that side. But like a general, maybe a nationwide survey that kind of actually tries to understand the impact of COVID. I've not seen the will to consider something like that being done. When we don't have data to, back it up, that's why we're not actually able to take decisive decisions to say, okay, this is how we can address.
I mean, doing this, hopefully later on in the program, we're going to be able to talk to the chair of the Federal Task Force for COVID, because it's been said that the economy is shrunken. The earning power in Nigeria has shrunken by, like a quarter in the country, and that the rate of poverty has increased by up to like 7%, and that's the limited data that we have. That's big, that's impactful. I want to take comments and questions from the audience, and I also wanted to say, because I was listening to you intently there, and I was just thinking it's true, what distance the Nigerian doctors and healthcare. Generally Nigerians go a long distance because things are difficult, how to make that better. I also was thinking about you and what it is like to deal with ongoing symptoms, where you can have some people who didn't have symptoms at all, or some have very little symptoms, and the stigmatization that can come from that, and the extra burden, of having to try and get people to understand that I may look well, but I'm not well, that sort of thing. It's, I feel, I really feel for you. We're going to take a break. When we come back from the break, I'm going to take the audience questions to you, and then we're going to continue to talk at the end of the day with Professor Tomori and also the head of the task force, the Federal Task Force for COVID-19 in Nigeria, after the break. Right, I'm going to start with the gentleman on my left with a nice hat. Go on, sir. What's your name? Patrick, go on.
Good to be here. Skepticism and distrust, I guess, will be with us for a while. Distrust of the government and skepticism from the part of the Talakas that believe that COVID-19 is the disease of the very rich, even though they are dying too in their masses. Now I'm worried because African Union on air recently told us that they've secured 240 million vaccines for the whole of Africa. And by the time I Google, Africa is about 1.4 billion. So, and I'm worried. Nigeria alone is about 200 million. So how many units are we going to get from what they've secured? And coming back home, even the little that the federal government told us they've secured, Lagos is more than 20 million. In this COVID time, people are how do we put it now, are converging in thousands at NIN centers because they have to do whatever with their SIM card and all that. So I now start asking, do we really know what we are doing? The government is telling us that they are serious. If you see the BRT buses, it's jammed. The whole seats are covered, and you see people standing in the buses. And for the private buses, you see a lot of people. There's no distance. There's no social distancing. So my question now is the government serious about tackling COVID-19? And for the people that think that COVID, especially the supposed poor, that think that COVID is for the rich, I want them to know it's for the rich and the poor.
Thank you very much. From what we have seen, the government knows what to do. They did it the beginning of this. We needed to continue that thing. Something went wrong.
Yeah.
You said it. We don't know whether it's resources
Yeah.
or whether it's just like we believed that things were okay. Apparently, they are not okay.
Yeah.
Permit me to mention something that she mentioned, stigmatization. It's very big. People are not talking about it. Even among health professionals, it's very big. People are not even telling the other person that they are positive.
Yeah.
And because what happens is that if the other person starts beginning to feel symptoms, the person giving it is you who have to say that you are positive. Not even know whether he has caught up with the virus before meeting you.
Yeah.
So people are not talking. Because we are gathering data as we speak. And with the way I'm looking at Lagos data, as I'm looking at every day I look at it, even those that I know are positive are not on the list.
That's even people who die.
So people that I
even
know are positive.
Numbers of
Can't see them
mortalities
to
are not
put their
covered.
name on the data collection.
Yeah.
Because what? They don't want to be. So we also need to start. It's a lot is that mental health part is still going to, like you mentioned earlier, all these things are going on. When we get to the lower numbers, flat cover and all, we'll now start seeing the post-COVID era as the case is. What are the issues that has done to people with depression, with people who have lost job, with a lot, isn't it?
All right. I want to thank both of you for coming. It's an ongoing conversation. COVID is going to be an issue, at least maybe till next year. You know, it's not a curse. It's just before you do all the vaccination, before you do all of it's going to take time. And so we're going to have ongoing conversations about it. But as for today, I thank you for coming.
Thank you for having me.
Thank you very much.
It's been a pleasure.
Right. I'm now going to have a conversation with one of Africa's leading minds in virology. He was also the Vice Chancellor of Redeemers University at the time. He's a national treasure of his own right, and that is Professor Tomori, Professor Oyewale Tomori. Professor Tomori, good afternoon. Good. It's good to see you looking so well.
Very well, I can hear you.
Good. It's good to see. Last year, at the beginning of the pandemic, you and I had a conversation regarding what Nigeria's response should be, what needs to be done, and so on and so forth. Are you happy with the way things have gone down or up?
No way, we have not. Let's not deceive ourselves. We should have done much better than we did. And now we are in the second wave, evidence that we have not done well.
Well, the argument was that Nigeria, the predicted scenarios for Nigeria did not occur. So it must mean that we did all the things we needed to have done to have stymied the pandemic, at least for Nigeria. You don't agree that we did?
First of all, I think our testing, as we said it a long time ago, our testing was not good. It's improving now, but still, I think we only reached testing about 1 million sometime in December, almost after a year, which is about 200th of our population. Countries that have succeeded are testing like about 200 per million, something like that, but we're testing much less than even one. We're not even testing 1 in 1 million. We've only done 1 in 200 million, which I think it's a very bad level of testing. countries that has remained quite low. In fact, much more lower than 1%. But you see our own has been fluctuating between 5 and 10%. So evidence that, we're not picking the right testing. We're not testing sufficiently enough. And it's been kind of haphazard. If you check the figures for testing, the period when we had the low figures, only about 8 or 10 states were testing out of 36. So obviously, these are evidence that we're not doing a good job with our testing.
Do you suppose that this is a capacity issue? I mean, it's not as though we are manufacturing the test kits in Nigeria or anything like that.
I don't think it is a matter of capacity. It is providing the facilities for the capacity you have to work. If you provide the test kits for the laboratories we have, they would definitely test it. They are the same people now who are testing, where 33 states are testing, compared to 8 before. So it's not a matter of capacity. It's a matter of what do you give your capacity to function? What the environment are you creating for them? You can have the best carpenter in any place, but if he doesn't have his saw or his nails or his hammer, he's as useless as any other person in that place there. So it is not a matter of capacity. Nigerians have the capacity, but we're not providing them with the environment for them to function effectively.
Could we have prevented the second wave?
Sure, we could have. I mean, if we had followed the non-pharmaceutical interventions, if we had obeyed the rules about putting on our face masks, washing our hands, avoiding congregation or large groups of congregations, then we should have actually put it under control. I'm not saying there'll be no cases, but I will have brought the numbers much lower, much lower than we're getting now. If you staying in enclosed places like churches, like event centers and things of that nature, that's what is killing us. And that's what is responsible for the big second wave we're getting.
Professor, how bad do you think it may get with COVID if we don't do what we need to do? How bad do you think it may get with COVID still down the line if we don't do what we need to do?
It's the saving grace that people are looking at is the vaccine. Many more people all over the world get vaccinated, unlike what is happening now, where only the rich countries are buying up the vaccines and nothing is coming to this area. I think they're living on false hope, because so long as COVID is in any part of the world, they too are also susceptible and vulnerable. Because when you get a vaccine, it does not mean you're going to get 100% of all the people you vaccinated will be protected. There will be some people who, for one reason or the other, will refuse the vaccine. So those people are exposed. There are also some people who, though they get the vaccine, they may not develop the right type of immunity. So there's a lot of vulnerability. Even if all the people in Europe decide to vaccinate all themselves and America, there will still be people there who will not. But then, if then we leave out the other parts of the world, like the so-called underdeveloped parts of the world, it means COVID will continue to rage. And so long as it's there, then they too are also vulnerable. You remember the issue of polio. The whole world is still not saying we are free. We don't have a global eradication of polio, because there are 2 countries that are still having the disease. That's Afghanistan and Pakistan. And because of them, we must continue to vaccinate people against polio, because anybody can move from one part to the other and still introduce the disease to your place. So also with the COVID, if so long as we don't have, the whole world is not protected, then everybody is still vulnerable. And you can get this, and who knows how long the immunity is going to last. We don't know yet. All these are new things that are coming. So you get vaccinated today, who says you still have immunity next year? We don't know. Therefore, it is important for everybody, as many as possible, get that vaccine to all the people in the world as much and as fast as possible. That's the only way we can say it's not going to get worse. Without that, the situation is going to get worse.
Right. Well, Professor, I can only thank you for your great example and all the warnings and explanations you've been giving around COVID and what needs to be done, especially about Nigeria and how it is that this is a time to seize the opportunity to become what we could possibly be. I hope that everybody hears you, and I thank you for your time.
Thank you also, and thank you for the work we're doing. Let's get the message out to our people. We can do it. This is our own country, and this is what we make of our country, that the country will be like. Thank you again for the great work you're doing and your team.
Thank you, Professor. Have a good evening. Well, I'm going to take a break. When I talk with Professor, I riled up myself thinking through exactly what it is that we can do, what's possible. We'll take a break. When we come back from the break, we'll continue the conversation. Well, to continue our conversation, I thought it was important to get the man. I'm one of the people whose onerous responsibility it is to make sense of the times that we are in. And therefore, my next conversation will be with the national coordinator of the Presidential Task Force on COVID-19, and that's Dr. Sani Aliyu. I mean, Dr. is an eminent microbiologist and spent a lot of years and work in the area of infectious diseases, including HIV and so on and so forth. Hello, doctor.
Hello, good evening.
Right. I'm just going to start by saying, why would you accept a job like this at a time like this?
Well, somebody has to do the job.
Yeah.
So, yes, I was actually invited to come and help out. I've been in the UK for 20-something years so far. And I was head of NACA for some years before returning back to my usual base when I was asked to come and help out. And of course, there's no greater honor than working for one's country. So no matter the challenges, I think it's a good thing, and it's good to have challenges once in a while.
Excellent. Yeah. So I mean, it's a good place to start from, talking about the UK and what's going on there and what's going on around the world. I mean, the country where you've come from, that's the UK. I mean, it's one of the most badly hit countries in the world. And in comparison to that, a lot of Nigerians feel still that COVID-19 is not a dire present danger for Nigeria. What's your opinion about that?
Well, when you look at it, the point I always put through is that this is a pandemic. It's very similar to having tuberculosis and malaria. This is a potentially preventable disease. It's just like saying, well, why don't we allow children to have measles? After all, malaria is more common than measles. And these are preventable illnesses. It's an epidemic we're in. And not only is it an epidemic, people are actually dying from it. It's a very severe illness when it affects certain individuals. If you look at our numbers at the moment, we're now running at well over 10,000 cases a week. Last week we had 10,300 cases for the first time. The highest peak we've had was in the first week of July, when we had 4,500 cases in July last year. So it's definitely increased. Even the deaths have increased, 77 deaths in just 1 week. Or more than 1,000 Nigerians having died from an illness that potentially can be prevented by people just following those public health measures that we keep on insisting on, such as wearing face masks, physical distancing, frequent use of hand sanitizers, or washing your hands with water.
Yeah.
And of course, avoiding mass gatherings. So it's a deadly disease. Yes, it doesn't kill everybody, but for those that it kills, it can be quite devastating. And even if you don't die from it, you can have long-term side effects. The youngest person in Lagos to die of COVID was just 27 years. And that's very young. And if you're above the age of 50 in Nigeria, up to 23% of those above the age of 50, based on our records, died. So it's quite a severe illness. It's not something that we should really say, well, it will be like malaria or typhoid. People do get better, and therefore it should be okay. No, because it's something that you don't really need.
What about the vaccines? How are we going to vaccinate over 200 million people, given the cost of the vaccines, the fact that you need 2 rounds, as we know of today? It might change tomorrow. It seems like we're in trouble.
Yes, it might change tomorrow, of course. There's a vaccine, the Johnson & Johnson vaccine, that hasn't come out yet. It's actually 1 dose. So things might change. But you're quite right. The goal is actually not to vaccinate everybody in Nigeria. The goal is to vaccinate up to 70% of the population, because that's what you need in order to establish herd immunity. You need 70% to achieve herd immunity. And then following that, we would also we'll prioritize certain groups. So, for instance, we'll start off with healthcare workers, because they're the that are most at risk. After healthcare workers, the front line, So security agencies, etc., people who actually interface very closely with the general public, and also the elderly and those with diabetes, hypertension, people who are most likely to die if they catch COVID. We're not going to start with young people because really there's no need at that point to do so. And the plan is we will vaccinate 40% of the population in 2021 and an additional 30% in 2022. Where is the money going to come from? That's one of the reasons why I said to you the fiscal space is very tight. It really is very tight, because I know this based on the negotiations we've been having with parts of government in terms of where the money could come from. But there will be a supplementary budget that would go to the National Assembly, hopefully in the next week or two, that would cover for that first 40%. 20% of the population would actually have the vaccine delivered free. And then the remaining 20%, we have to buy the vaccines ourselves with our own money. But even that 20% that will be given to us free in 2021, we have to find the money for the logistics. We have to find the money for paying healthcare workers for the delivery of the vaccines, etc. And then in 2022, the plan is that it will be put into the 2022 budget. Unfortunately, we didn't have the time to put it into the 2021 national budget, but it will go as a supplementary in the coming weeks.
Which 20% will be getting it free, and who will be the rest not getting it free? 80%.
No. So in 2021, we will cover 40% of the population. Okay. So 20% of that population, the first 20%, it will be free. The amount, 20% of our population is 40-something million persons. So that amount of vaccine will come in free from Gavi. We are not going to pay for the vaccine. And then another 20% we will have to pay. The government will have to buy the vaccine. But when it comes to the last mile, the vaccine will be given free to everybody in Nigeria. We will not charge people for it because it's a public health intervention. Public health intervention, you don't charge people because you want everybody to take it.
COVID is going to change the world. Everybody says the way we live, the issues of climate change, the issues of sustainability in every sphere, education, healthcare, public healthcare in particular, all of us are the front burner now. I'm not quite sure what the plan is for Nigeria.
So for Nigeria, one of the things that has changed, and I'm sure you've noticed it even for those outside government, is the priority has now changed to issues such as health. We were spending a lot of money on infrastructure, but it's very clear that for you to create wealth, you need to have a healthy population. And moving forward, I am very certain that the funding for health going into subsequent years will improve. That is, there are some spin-offs that we've had as a result of COVID. So for instance, the number of molecular laboratories we had in the country were just 3 or 4 when the COVID pandemic started. We now have virtually every state has capacity for molecular testing, which will affect things like Lassa. You'll be able to diagnose Lassa much faster. You'll be able to diagnose Ebola much faster. And even when it comes to the delivery of the vaccines, some of the primary healthcare centers that would be given the vaccination, they will have to be renovated. They will have to have running water. They will have to have electricity, such as solar electricity, refrigeration, etc. And healthcare workers themselves, when you look at the amount, we've trained over 35,000 healthcare workers on infection control. Almost 36,000. That's huge. And these are healthcare workers that span across the length and breadth of the country. So, and even when it comes to the vaccine, now that the vaccines are coming in, the private sector are already showing great interest in that. But overall, probably the biggest advantage, well, you can't have an advantage with a pandemic, but probably the biggest spin-off, I think, is the attitude change that people have. People have realized how important health is, how important it is to keep yourself safe, and also to value what you have, whether it's family or whether it's your work or whether it's your lifestyle, etc. Some of people were locked up at home for 5 weeks. So, a lot of people could have gone mad as a result. The moment you release them, suddenly people realize actually the things that we were worried about before actually didn't matter, because this epidemic far surpasses any sort of at any sort of scale of concern that we would ever have had. So Yes, there are spin-offs. Yes, there have been things that we have learned from, and I hope we will be in a better position in the future to be able to manage future epidemics, because they will come.
Right.
They will come. Another pandemic will.
I can imagine. Of course, that's a fact of life. I mean, I've got to go now, and I wasn't going to ask you the question about accountability anymore because that's my job to find out. However, the last question I'd like to ask you is, when will this be over? When are we going to go back to normal, and what will normal be?
We will get back to normal. No pandemic has lasted forever, but if we follow the public health measures that we keep on talking about, wearing face masks, physical distancing, avoiding crowds, washing our hands, etc., and when a vaccine comes, making sure that if we fall within that group, we get the vaccine, this thing will be over within a year. I am very sure of it. But meanwhile, we just need to make sure that we keep safe, and we continue to take measures to avoid catching COVID.
Right. But thanks very much for spending this time with us. Even though this is a very good way to interact, we hope that in future we are still going to be able to get you into a setting where you can actually take questions from Nigerians and other participants and stakeholders in matters such as this.
Thank you very much for having me.
Right. Bye-bye.
Bye-bye. Bye-bye.
Well, that's our conversation for the day. I hope you enjoyed it. Remember that you can join our conversation. You can do this on any of our social media platforms, and you will see us next week when we'll take on the next topic that we should be putting the public focus on. Bye-bye now.